Namaste everyone.
The mouth a mirror of your overall health. Poor oral health can have a negative consequences for the entire body. Here are some serious health problems caused by bad oral health. Alzheimer's disease, head and neck cancer, periodontal disease, heart disease, atherosclerosis, respiratory disease, pancreatic and kidney cancer, liver cancer, diabetes, rheumatoid arthritis and pregnancy complications. Scary, right? Don't worry. Today I am going to explain you all the best way to prevent serious health issues caused by bad oral health, as to practice good oral hygiene. Now the question arises, how to practice good oral hygiene? Brushing teeth twice a day, avoid acidic drinks, floss teeth once a day, drink lots of water, quit smoking, rinse the mouth with chemical mouthwash? No. Practice oil pulling. Oil pulling is self-care practice which has been practically implemented from ancient times, since the 2nd century BC. This practice is mentioned in the ancient Indian scriptures, Charaka Samhita Sutrastanam Matrashitiya Adhyayah, Sushrita Samhita Chikitsastanam Dhumanasya Kavalagraha Chikitsatam, in Ashtanga Sangraha Sutrastanam Gandusha Vidhihi.
Let's see how to oil pull. Ancient texts explain two methods, Gandusha and Kavalagraha. Now we'll see Kavalagraha. Take a tablespoon of desired oil. Take it on empty stomach in the morning in your mouth. Try not to swallow while doing squishing to prevent the toxins getting back to your body. The oil needs to be squeezed around long enough for it to turn a milky white, which indicates that the bacteria has been pulled off. Oil pulling prevents bacteria from entering the food pipe and eventually your internal system, supporting your ongoing detoxification therapy. So it is believed to remove heavy metals through saliva. Pushing and pulling oil in between the teeth. Swish the oil in your mouth around for 10 to 15 minutes. Make sure your pulled oil has turned milky white. Spit the oil into the toilet or trash, because it could clog the drain if you use your sink. Second method, Gandusha Vidhi. One should hold the large amount of oil in their mouth till the mouth gets filled with kapha or mucus, or till the nose and eyes starts lacrimating. After the procedure, immediately rinse your mouth with lukewarm water to remove the toxic debris. When you are done, brush your teeth as you normally would.
Which oil is used for oil pulling? Oil pulling should be performed with sesame, sunflower, olive or coconut oil. Sesame is the original oil described in the Ayurvedic text. In recent years, coconut oil has become popular because it has antimicrobial, anti-inflammatory characteristics attributed to the existence of lauric acid. Quite certain to get this doubt, how oil cleanses the mouth. Oil acts like a cleanser while swishing around the teeth and gums. The formation of sodium laurate, the main component of soap, which is formed by the interaction of lauric acid found in oil, and alkalis exist in the saliva, such as sodium hydroxide and bicarbonates, producing sodium laurate, soap-like substance which causes the cleansing effect and decreases plaque formation in the oral cavity. When we have amazing natural sources, why we need chemicals? Your mouth needs good bacteria. These germs help break down food and kill the bad bacteria that can lead to oral health problems. Unfortunately, mouthwashes that kill 99.9% of the bacteria in your mouth are also killing of good bacteria. This can damage the mouth's microbiome and its ability to fight cavities, gingivitis and bad breath. A 2016 study concluded that mouthwashes may also contain synthetic ingredients that have been linked to an increased risk of head and neck cancer. So say to no chemical mouthwashes, switch to natural, safe and effective oil pulling for good oral health. Is oil pulling safe for children? Definitely, there are no side effects. This can be done by any age groups, be it kids, adults, elders or pregnant women. Contraindicated for children below 5 years due to the risk of aspiration. Interesting history of oil pulling. As we all know, it is an ancient oral care practice, but it is practically implemented initially in 1990s by Colonel Tummala Koteshwar Rao of Bangalore, Karnataka. introduced and popularized oil pulling in South India. In 1992, by Dr. F. Karaj claimed that oil pulling could cure a variety of illness ranging from heart diseases and digestive trouble to hormonal disorders. Does oil pulling really work? If we analyze on scientific backgrounds, they stand out the best. This mentioned scientific study explains improvement in oral hygiene and to cure more than 30 systemic diseases, with promising positive results. For deeper information, I had given the scientific studies link in the description below. By stepping to fruitful part of our video, which is numerous benefits of oil pulling. As per our ancient scriptures, Acharyas quoted, oil pulling has been used to prevent decay, oral malodor, gum bleeding, dryness of throat, ringing in ears, cracked lips, and for strengthening the teeth, gums, and the jaw. It is a simple daily regimen which, when done routinely, enhances the senses, brings about a feeling of freshness, and maintains clarity in the voice. Added benefits of oil pulling as per scientific studies. It boosts immune system, by this I am saying lesser chances of allergies, improves digestion, better gut health, better skin, so much more. Reduces inflammation and stress, great aid to reduce internal inflammation and stress in the body, and these things are further responsible for so many diseases. It has a very powerful detoxifying effect on the body, prevent thrombosis, intestinal infection, decreases incidence of diabetes, bronchitis, asthma, migraine and skin problems. Plus, some studies also says that it is an aid in weight loss, stimulates the brain and reduces the chance of heart disease. With these regular, effortless exercise, one can reduce inflammation and infection easily, which can avoid use of antibiotics and make your dental visits when it is truly required. If you found this video useful, like, share and subscribe.